Innovative Youth Education and Enhanced Leadership Project, linking schools to SRHR services for gender non-conforming leaders and sexual minorities in Zimbabwe. In a country where key populations are highly stigmatized, segregated, and at times persecuted, the Innovative Youth Education and Enhanced Leadership Project opened a window of hope among learners by contributing to an enabling environment where non-conforming students' rights are respected. Let us hear what the learners, teachers, and religious leaders have to say about this wonderful project.
I am well in the Youth Network, Youth Innovative and Enhanced Leadership Program that was sponsored by INERELA since last year. It has taught us a lot about how we have access and rights to sexual services all around Zimbabwe. I am very grateful that I was able to acquire such information at such a young age, and I would hope that the same information could be given off to other children all around the nation, even in remote areas.
In line with comprehensive sexuality education, I'd like to share what I learned from INERELA. As students, we must expect to learn more from our teachers and our leaders. For example, we learn GNC, which provide peripheral issues, whereas this program called INERELA provides and looks deep into children's rights and several issues. So I, as a male student, I've reached puberty, and now I'm aware of drug abuse, abstaining from sex, and so forth. So I can recommend that INERELA must amplify our voices to remotest areas such as Gokwe, so that our generation could not collapse.
We learned a lot of things from this program, where we learned about the access to the strength to access to our health, to our reproductive health services. I'm quite grateful to this project, right? Because I'm now free, and I'm now able to take care of myself without the help of anyone. So I'm encouraging you guys to spread this information to everyone, so that he can be able to know about his or her sexual reproductive health.
I'm very happy to be part of the Youth Leadership Program, which I've been part of since last year. I can say we have gained a lot of things from this project. It's a wonderful project indeed, of much commendable efforts that has been done by this project is the behavior change amongst our students. We have noted a lot of positive changes because of INERELA. We have also noted that our kids have developed good leadership skills through these programs. They are also now free to interact with us as teachers to talk about sexual education. They have also come to realize that discrimination should not be part of their school activities. So we are also here to plead with our funders, or to plead with funders like IAM and INERELA Zimbabwe, so that they can channel their resources towards these activities, so that INERELA can be more visible to other schools, not only to Kenzim. We also ask them to encourage other civic organizations to network with them, and also to network with schools, so that they can expand their programs, so that their intervention efforts can be recognized throughout our country.
First of all, I'd like to thank INERELA for giving us a sexual talk platform that is free and open to everyone. I would also like to thank the supporting groups like RCF and IAM. Then going off to my topic, I'd like to talk about the children who are being discriminated the most in our society, in our communities, in our countries, everywhere around the world. Those people are not being included in whatever programs that are being done. I would like to talk about the minorities and the vulnerable groups in our communities. I once read a book, Animal Farm. Napoleon once said, all animals are equal, but some animals are more equal than others. We'd like to share that statement forever in our communities, everywhere, wherever we are. We'd like to share that statement because every animal is equal, so are humans. We'd like to include our fellow vulnerable groups like the blind, the people with disabilities, people who can't walk, people who can't talk, people who can't do anything, people who are not able to fend for themselves. We'd like to support them because those people, they are also humans. So people who are blind, we'd like our teachers to be trained on how to actually relate with those people. When we learn, we'd like the teachers to know how to read the Braille, to know how to mark their books, because those people are actually intelligent. There is intelligence behind those, behind the blindness, behind the wheelchair. There is also intelligence.
Education is the right of every child. Every child deserves education because education helps other people to be successful in the future. For example, disability doesn't mean inability. One with disability can do things that one with both parts cannot do. For example, people with disability, they are facing discrimination whereby one can say this one has disability, he cannot do that, he cannot do this. Also, we have people living with HIV and AIDS. Some people, they can say HIV, but the one with HIV can be more successful than the one without HIV.
The learning environment should be equal. There should be an equidistant between all of us, the abled and the disabled. At school, leadership, for instance, the prefect board, should comprise of all the abled and the disabled. And also we should all be bound to one destiny, that is success. Success comes with a prize. Teamwork, commitment, tolerance. We should tolerate each other at school. At every point, we should tolerate each other. That's how we can interact as social agents. You know, at a point, I was once one of the disadvantaged because I was called an orphan because I didn't have both of my parents. But you know, I managed to succeed just because I was motivated by other peers. They motivated me to be who I am today. So there are people out there who need motivation to keep moving.
I would like to thank INERELA for coming to TCRD. Well, since we've been working with them for the past 2 years, I want to thank them with their partners, which they were working with the RCF and the IAM. Since they came here, we have noticed a lot of changes in mostly the students and all the teachers that we've been working with. Because now we have seen a decrease in many aspects, especially bullying. Bullying is now reduced dramatically, and now in the school has zero tolerance to bullying. We have actually now we are very happy to see that most of the students, in fact, are now accepting the sexual minorities, since because as they started, students were seeing that they're quite different, but with realization and teachings from INERELA, we've now allowed them to accept one another, meaning that all students now accept each other, whether their differences, whether they're sexual minorities or religion or any disability.
We are quite happy to be in association with our funding partners, RCF, and also through IAM, that is the Inclusive Affirmative Ministries. We have a project that is running within the schools, namely the Schools Out project, and then the Youth leadership program, which we have actually taken to some 4 schools in Zimbabwe as of now, covering a total population, student population of about 4,000, if not 5,000. We want to talk about the effects and the impact of this project from a policy level. We have actually seen that rolling out the comprehensive sexuality education program within the schools has actually been received well by both teachers and the school administrators, and also the students were actually very happy receiving it. We want to recommend strongly along the policy issues that one, there is need for the operationalization of the school's health policy such that it is going to bear a lot of fruits within the schools, and then be in a position to provide an inclusive environment, a safer space for the students to learn. And also, we also want to operationalize the schools' sexuality education so that it becomes examinable within the Zimbabwean education sector, just like history, just like English. If it is examinable, then its importance is going to be felt by both students and the teachers, and they are going to take it seriously. And by taking it seriously, it is also going to transfer into tangible benefits that are going to be realized by the students in terms of their behavior change or transformational change. We are going to see even a reduction in terms of early child marriages, teenage pregnancies. We are also going to see a reduction in drug abuse. We are also going to see a lot of inclusiveness and a lot of togetherness within the student body, so that even the sexual minorities and other the vulnerable communities are also going to be in a position to be feeling accommodated within the school system. We also want to encourage the funding partners to put in more monies for capacity development of teachers, so that if they are going to be looking at the CSE project, they are also going to be learning it and also implementing it from a competent based level, and they are going to be in a position to conceptualize the skills, so that if they are going to now impart their knowledge to students, they are going to do it from a vantage point of knowledge, and then they can actually be in a position to influence their students positively. So we want to call upon the donors to put in more monies for the capacity development of teachers, and also strengthening the inclusive access to reproductive health services, health rights services by all young people, including the sexual minorities, is also an advantage, in the sense that, you see, everyone is going to be included on board. No one is going to be left out. Zimbabwe has a series of instruments that are directly promoting these issues. One, we have the SADC SRHR strategy of 2019 to 2020 to 2030. If that one is going to be implemented within our country, we are going to see that the minorities are also going to be involved. They will have a safer space within the schools. Then this Constitution of Zimbabwe as well is also user-friendly, in the sense that it does not promote any form of discrimination. And in it, each and every individual has an inherent dignity that is enshrined within the Zimbabwean Constitution. So it creates room for accommodating all the other people who are not going to be in a position to be left behind. Then the other important factor is the Zimbabwe National HIV and AIDS Strategic Plan of 2021 to 2025. This has some some attributes which promote access to health rights services by all young people, if it is taken on board. And also, in addition, we have the national guidelines on clinical adolescent and youth-friendly sexual and reproductive health services provisions. This element promotes access to services by all young people, and also the Zimbabwe school health policy if this is also implemented, it will create safer spaces for adolescents or for youngsters within the school environment. And also, we have the not a popular one, the Zimbabwe National Key Populations HIV and AIDS Implementation Plan of 2019 to 2020. This should be amplified and should be in a position to be implemented fully, so that access to health services is going to be given to all and sundry youngsters within Zimbabwe. And lastly, strengthen the referral system for young people in schools. In the research that we did as INERELA, we found out that organizations do not have a clear referral system for students to access health services. So young people who are in this school setup need to be given a straight referral system. So I want to say to all those who are supporting us, the funders and also the other implementing partners, please continue doing this good work. If it can cascade to every corner of Zimbabwe, then that's going to be good. The rural areas, those in areas like Gokwe, Mzarabani, we need this information to go out to cascade, so that comprehensive sexual education should also reach those areas. Thank you very much. Zimbabwe has a mammoth task and we need a lot of assistance. Thank you very much.